let's say CAR T-cells and other immunotherapies are really a paradigm switching therapy or strategy in fighting cancer. But it's not a holy grail yet. So we still face challenges. So relapse, so there's a clear need to improve that. But there's also toxicity. And neurotoxicity next to cytokine release syndrome are the most important limitations and needs to improve. Or needs to identify predictors for these therapies. But of course, it needs to be early predictor. One of the predictors is likely being the CAR, let's say, construct itself. But are there also recipient predictors? And if we are able to identify recipient predictors for these neurotoxicities and or cytokine release syndrome, but we are focusing on this abstract mainly on the neurotoxicity. It helps us to be prophylactic or preemptive with regards to mitigation strategies or trying to prevent these neurotoxicities. And what we did in about 80 CAR T-cell therapy patients, we did an OLINK-proteomic screen for, let's say, potential toxicity analytes. And we have related that to neurotoxicity after infusion of the CAR T. And what we found that there were a handful of neuroprotective analytes already decreased on the day of infusion of the CAR T cell. So if we are able to validate this in another cohort, it's maybe an interesting marker to go after, because this suggests that there are recipient markers available that can predict or may increase the probability someone is developing neurotoxicity after infusion of the CAR T cell. And then we can target this group of patients to apply preventive strategies, for instance, anakinra or other immune suppressive agents that do not impact the efficacy of the CAR T, but may prevent these devastating, let's say, complications after infusion of the CAR T.